Pediatric is one of the subject which we are really scared of, especially when tackling acutes, because whenever homeopathy seems to be very good with children. Children love homeopathy, but whenever we face acutes in children, we get scared. Whenever there's an acute emergency, we take a back seat, and at that moment we say, okay, you take any antibiotics or you go for antipyretics. But does homeopathy offer a great form of treatment in acutes, and how to follow that thing? Today, this is what I'll be going to share about. So, just give me a minute. Fine. So this will be my presentation today. I'll just start with the sharing of my screen. So homeopathy and pediatrics is my today's topic. So before I start, I really like to thank Dr. Samuel Hahnemann, because this wonderful art of homeopathy, this wonderful science of homeopathy is a great blessing to the humankind. Not just because I'm a homeopath I'm talking this, or not just because I have been taking homeopathy, but I've seen homeopathy doing miracles in cases where people were really hopeless, people were really had no choice but to give away to disease. But at that moment, homeopathy has helped people beautifully, classical homeopathy. So if Dr. Hahnemann would have not been there, I just believe the cases which I have cured, which were nearly very incurable cases, or you all have cured those cases, they would have been still suffering. So I really thank Dr. Samuel Hahnemann for this wonderful science homeopathy. And not to I would like to thank my guru, Dr. B.H.M. sir. Because of him, whatever I am, he is a wonderful teacher who taught me the correct classical homeopathy. Professor Vitalka sir, under whose guidance I've done the course of IACH Greece, and I'm really influenced by his teachings. So let us go ahead. These will be the points which I'll try to cover in my today's talk. My points will be like to learn the essence of pediatric case taking. Because I remember when we were a student, we were in college, the only thing whenever we used to get a pediatric child, we used to think how to take a case. What will a child say? We all face these problems, like a child doesn't know what his mind is. What does parents know what the mind is? So this part becomes quite difficult, and we'll end up giving Kali Sulf for cough cases, or we'll end up giving Antemtart to cough cases, or urinary tract infection, we'll end up giving sarsaparilla or some other remedies. Without understanding a child, we take these steps. But today I just try to give some directions how we have to approach in pediatrics in a most classical way. Also in this talk, I would like to cover how to understand mind of a child. And the best way to understand a mind of a child is by mastering the art of observation. Dr. Samuel Hahnemann has spoken about observation in his aphorism footnote 85, and this is what we have to apply in pediatrics. And once we master this art of observation, pediatrics will be the most easiest thing to solve. And trust me, even though I get tough of the tough pediatric cases, I'm very happy because I know they're the most uncompensated mind, and I just have to work out with my observation, and it really helps a lot. I'll try to explain some differential pediatric rubrics, materia medica, and I'll try to even make you understand how to apply the child's psychodynamics into materia medica and how to apply it to our cases. I'll try to show some cases, and we'll get some answers like, does art of observation really help in solving pediatric cases, and how to communicate with our little patients. In my practice, I usually try to communicate with the child first rather than with the parent. Like whenever a child comes into the clinic, I just try to talk. I just try to, intrude into the child's space and see what reactions he's throwing. This is what I've learned from my teacher, Guru, Dr. B.S. Bhosle sir. And after applying this technique, I have understood and seen different reactions of every child. Like for example, if a child enters to your clinic and you just talk to the child, how are you? Are you okay? What happened? What is your name? And he will look down. Again, you ask a question, how are you? You're okay. What is your name? And he will give the answer and he will look down. So I remember one case where there was a child of 8 years age and he had thyroid. So they came for homeopathy. It was hypothyroid child and they came for homeopathy. So I was taking the entire case, asking his parents about the symptoms, and whenever I was communicating with the child, what I observed the pattern, like, I'm looking at the child, asking him the question, and he just looks down and he gives the answer. Like, for example, how's your thirst? He will say, my thirst is good. And when I talk to the parents, he will look up. So this repeated pattern, I put this rubric, took as a rubric, and I put in the repertory. And the rubric is evading the look of the person when you talk to the person. So the main remedies which come for this rubrics, evading the look, remedies like you have Natrium miraticum, you have Plumbum, you have Cuprum, you have Agaricus, you have Stramonium. So this was one of the most repeated observational symptom which I observed in the child. Again, for observation, I would like to add one more thing. Just do not take that rubric which the child just throw once. You have to just see, is there any pattern? Is this pattern repeated? If yes, then that is a strong rubric or that is a strong symptom which you should take into consideration. And of course, I gave the child remedy Stramonium because there were some other symptoms like he was a very frightened child and he had fear of dark and he had history of abuse in his childhood. Like just before this incidents, he was abused by some of his friends. He was little fat, so all his friends used to tease him. They used to tease him to such an extent that he used to get violent and he used to hit the children. Again, abuse, history of violence. But again, the child was very timid. He always used to be with his parents. And this rubric, evading the look, that confirmed the remedy, and I gave him Stramonium, and I was very happy with the results of the case. I saw drastic improvement in his thyroid level, and that child was labeled a normal child. So this is what art of observation we have to apply in our cases. So one simple question which always arises, and we should always think about this: what is the need to treat pediatric cases with classical homeopathy? So, many times in practice, we see people just give a remedy. Like, as I said, there's a lot of cough, you give Ipecac. There's a lot of cough, you give Antemtar. There's cold and coryza, you give Alum Cepa. But have you ever thought, what is the need to treat pediatrics with classical homeopathy? Because, when you are a child or when you get a child as a case, they are the foundational age. That is the foundational age of that person. Like whatever you put as an input at that age in all the levels, like be it social level, be it emotional level, be it medicinal level, be it mental level, that will form the foundation and growth of his future life. So when we get pediatric cases, we have to be super careful what remedy we are prescribing. Because I remember a statement by Professor Vitilka sir. He said, our medicines are though very minute, are more potent than nuclear weapons, nuclear bombs, because they have the capacity, if given in a wrong way, they can just disturb the whole human economy. Or there's harmony inside every human being. So these medicines can disturb that harmony, or when you give the correct remedy, they can set this harmony in a proper way. So I believe personally, whenever we get pediatric cases, we have to be very particular. We have to be very vigilant what approach we are giving to the child. There are so many doctors who just blindly give, homeopathic patents. I remember there was a person who came to my clinic and he just came to take some medicines. Someone had prescribed a remedy and the child was just 3 years old, and someone had prescribed Sorinum 1 m daily for a month and some mother tincture, and it just gave me goosebumps. I was like, how can someone prescribe Sorinum 1 m for 1 month for a 3 years old child, and he has never seen the child? He can just beat his immunity. He can just destroy his foundation. So, we have to be extra careful and vigilant and with treating a child. So the next question, after when we decide, okay, I will treat children with classical homeopathy, the next question arises, how? Homeopathy is too slow. This is one thing we are doubtful, and the patients. Second, we are actually very scared to tackle acutes. TK patient is having LRTI, URTI. We give homeopathy. Whenever they get acute, okay, you give antibiotics. Okay, you take this anti-allergics for this time. We'll see when the patient is settled. I think that is not the correct way to go with, right? Then we are doubtful when a child comes with acute fever, leukocytosis. Okay, for this time I'll give antibiotics. Next doubt: should I fear fever? Whenever pediatric child comes to my case, so I always tell the parents, I will start the treatment, and for initially 3 months, there will be a lot of ups and downs in the cases, specifically when the child has a long history of suppression by antibiotics, antipyretics, or anti-allergics. So I just tell the patient there will be lots of ups and downs in initial 3 months. You have to be with me. You do not have to get scared of fever, because fever is something which is very good and I expect after my correct remedy. So should we fear fever and how should we approach? I will be talking about those things and how good it is to prescribe specifics in children. So these are some of the points which I will be trying to clear in this talk, and I'll go with the first case. This case I saw this year in the month of February. So this child approached with high-grade fever, acute leukocytosis, and very bad chest congestion. So he was having fever since 3 days. The fever used to go to 103, 104, and his fever used to come every 4 to 5 hours. So they came to the clinic, and they are my old patients. So they came to the clinic, and the patient was sitting. He was drowsy. He looked toxic. His respiration was very fast. His respiration rate was very fast, and his eyelids were drooping. And the mother was actually an aconite patient, so she was very anxious. So you can understand what kind of load I had on my head. So the fever used to come every 4 to 5 hours. The patient complained of nausea and vomiting with fever, which is again a very common symptom. The cough was dry. So the mother said that the cough was dry at night and it was loose all the day. So the child used to throw a lot of phlegm throughout the day, and only at night he did not have phlegm and just dry cough. And whenever he used to cough, he used to vomit. So as I said, the child was toxic, drooping eyelids, and I found a very strange symptom in the child. The child was just asking for sugar in his fever, and the child felt hungry during fever. So whenever he used to get fever, his temperature rise, and he was asking for food. And along with food, he was asking for a lot of sugar. So these were all random symptoms I got from the mother, because such kind of cases we cannot give half an hour to 45 minutes. We have to be very quick. We have to be very sharp in observation, and we have to try to extract Pcos symptom as much as possible in most minimum time. His cough aggravated after eating, and his cough was better by warm water. So this was the present situation of the child. This is what the mother gave me. I didn't had much time, but these were the symptoms I got. So during that process, when I was taking symptoms from the mother, I was engaged myself observing the child. So I just touched the child's soles and palms. They were warm. They were burning hot. His vertex was very hot. His eyelids, normally whenever the child came, he never had redness of eyelids. Here his eyelids, this part was red. His eyes were red. His lips, his orifice was red, and it was burning. There's a lot of burning in the child. The child was very dull. There was like congestion in the face. It could be seen. Desire for sweet. And whenever the child was coughing, the cough was very peculiar. So in the cases of cough, I usually ask 3 to 4 things to do. I ask the patient to do 3 to 4 things. First thing is I ask the patient to cough. Second, I ask the patient to, when I'm ausculting the chest, I observe that when I'm ausculting the chest, what are the chest sounds I get? And when I ask the patient to take air in or breathe out, I notice at what moment the patient is coughing, because this again gives us a spontaneous observational symptoms. Some remedies will cough when they are taking air in. Some remedies will cough when they are taking air out. They are breathing out. So this again pattern has to be a repeated one. Only then we can take that as a symptom. So when I asked the child to cough, this cough was very forceful. Like he was coughing like, I mean, I was wondering, he was just he'll take out all his lung out of his mouth. He was coughing so forceful, and his cough was very suffocated. I could feel that when the patient was coughing, his face was turning red and he was feeling suffocated. So these were some observational symptoms which I found. His thermals were changeable. Sometimes he used to feel hot, sometimes he used to feel cold, and his thirst was on lower side. So the child, like before he came, I asked them to go for WBC count, and the child's WBC count was 19,000. You can see here, his WBC count was 19,781 before the remedy. And we all know in this situation, doctors will directly ask the child to get admitted. The child will be given antibiotics. He will be hospitalized for a week or so. They will suppress the case very badly. But I took a chance because I was very sure about the remedy which I'm going to give. So the rubrics which selected was, his appetite had increased during fever. Appetite ravenous, increased during fever. He had a lot of nausea whenever he used to cough. So this was a very strong symptom. His mother said he is not nauseatic, he doesn't vomit till he is not coughing. But once he starts coughing, he feels nausea. He said, Mama, I feel like vomiting. And he goes and vomits. So this pattern again happened in my clinic. So his mother was carrying a polythene bag. So whenever the child was coughing, he used to say, Mama, I'm feeling nauseatic. And she used to give the polythene back and he used to vomit. So these two rubrics were very important for me. Nausea and vomiting during cough. Next rubric was cough, dry, night, loose by day. Because this is again a very strong and characteristic symptom of the case. Next rubric, eating after aggravation, cough. Cough was forcible, which was again an observational symptom. Cough was suffocative, observational symptom. Food, drinks, desire for sugar. Warm drinks ameliorated the child. Heat of soles and palms, heat of vertex, and skin discoloration, red orifices. So the remedy was very simple. The remedy we all might have judged. This remedy was sulfur. So I gave the child sulfur 200 stat dose, just one dose. And the child was advised for a follow-up after 2 days with a CBC. Because see, we have to again educate the mother and the child. We are not going to get his fever down, because this is not what homeopathy aims at. Homeopathy doesn't aims at getting the fever down. But what is the process behind fever? Process behind fever is his high WBC counts. There's an infection. His immunity is little poor. So we have to raise the immunity, stimulate his own body's defense mechanism, and his body will start killing the infection. And gradually when the infection comes down, his fever will come down. So for this child, I gave a clear-cut instructions. I'm giving the dose today. Tonight and tomorrow, your child will cough and get a lot of mucus out. Let him get, don't get scared. Because many times what happens when we give the remedy, the reaction of the remedy is there's a lot of cough coming out. And we get scared and we give some cough syrups to just suppress the cough. But we have to understand one thing is, if there is a lot of cough in the chest which is not coming out, or the body is not throwing it out, obviously the child will land up into pneumonia. So when we give our medicine, this medicine will let the cough out. And once the cough is thrown out of the body, gradually his infection will come down. So the same thing happened. The child, the next day he coughed, he just removed a lot of mucus, he had fever. But the interval of fever had increased. The fever which he used to get after every 4 to 5 hours, it had become 6 to 7 hours. And also the fever was not to 103, 104. It used to be up to 101 and 102. So the next day, on 8th, the WBC counts were 19,781. His dengue and malaria tests were negative. On 10th, after 2 days, I asked him to get the WBC done. His WBC count came to 9,820. Trust me, at this situation also the child had fever. He used to get fever every 5 to 6 hours. But I was damn sure looking at the reports, yes, the child is improving. His infection is in control. Now, he will cough for some time, maybe in 2 to 3 days, his fever will go completely. I just had to convince the mother, your reports are okay. It is okay to have fever. He may have fever 1 to 2 days. The interval of fever will increase. This is what we have to see. So his toxicity improved after 2 days. His appetite was good, improved. Expectoration increased. Again, I gave him just placebo because I had a beautiful reaction of the wonderful action of the remedy. And I again advised for a CBC after 2 days. And after 2 days, that is on 12th, his CBC count came to 6,810. And after 2 days, he used to get fever once in 12 hours. And fever used to be around 100, 101. Yet he was coughing. His cough had not come down, but he was not vomiting. There was no nausea. So these are his reports. This is on 10th. We can see his WBC count has come to 9,820. This is the report for 12th, and we can see his WBC count has come down to 6,810. So this child was treated with homeopathy alone. No antibiotics were given, with just a single dose of sulfur. And we can see a beautiful, beautiful action of homeopathy with no antibiotics. So let us know something about sulfur. So sulfur as a remedy, or there are a lot of sulfur cases. There are a lot of sulfur children I've seen in my clinic. And you know, one thing we notice about sulfur is they are very confident children. We always, we studied sulfur in our books. We have studied about them. They are rat philosophers, or they are dirty looking. They don't have proper clothes. Their clothes are torn. But this is just one shade of sulfur. You know, there's another shade of sulfur where you see this child or this person, sulfur, is a very confident person. So when you talk with a child, sulfur child, and when you greet him, hello, how are you? He will reply to you with a very good eye-to-eye contact. I'm good. How are you? And when you ask his name, he will not look at his mother and give the answer. He will just give his answer directly. If he has to be some other remedy like pulsatilla or barataka, and if I ask him, what is your name? So the pulsatilla will just look at mother. She'll get shy. She'll look down and she will give her name. Because he or she is not much confident. First thing, pulsatilla, she will ask permission of the mother because she is scared of strangers, and because she is timid, she'll look down and give the reply. And the same thing when you ask a Baradaka child, what is your name? He'll just look down, he'll go behind his mother and he'll just hide. So one thing what you observe about sulfur is they are very, very confident children. Even sulfur child, just looking at a 3 months old, 4 months old child, when you just call the child's name, just look how he responds to you. If a child gives a very good eye contact, one of the remedy is sulfur, other remedy is bromium, another remedy is opium and chocolate. They're very confident people. Even in school, these children are very confident. They will make friends easily. They like to be, leader in their group. They are not like lycopodiums. Lycopodiums also like to be leader in the group. They also try to show they are confident, but inside they are not confident. But sulfur will not show. They are basically very confident children. Again, this sulfur children, every time they'll come to your clinic, they will always come with a lot of ideas. They keep on studying about world, about planets, different, science plans, ideas, and they'll try to share with you. They'll not just keep their ideas to themselves. They are very energetic, they have a lot of knowledge, and they ask a lot of questions to you. So one thing I confirm for sulfur is I ask the parents, does your child question you a lot? And the mother says, yes, I'm tired. He just asks why for everything. Why, mama, the plane is flying and it is not falling down? Why, mama, the moon comes at night and sun goes? Mama, where is God? He will just ask me a lot of questions about science, about world. And I'm just tired giving him answers. So this is sulfur. A lot of ideas, a lot of energy, a lot of knowledge, a lot of curiosity. And there is marked redness. You will always see sulfur with redness. And they are very smiling children. There's a lot more to speak about sulfur, but we have very limited time. So I'll just give some glimpses of this remedy. To remember sulfur, you can remember a volcano. Like, how is a volcano? Volcano is full of energy, erupting, redness of orifices. It is a base of everything. So just remember sulfur with that. And sulfur comes from volcano. A lot of energy, that is sulfur. So I'll share another case. I'll go to another acute case. It is a case of inflammation of knee. So this girl, her age 3.5 years old, she came with the following complaint. She developed sudden pain of left knee since 10 days, and there was a lot of inflammation and swelling. So her parents says, my daughter is not able to, walk. She's not able to fold her leg, and she's just weeping. There's a lot of pain. She's not able to stand pain. She cannot do her daily activities. And they were so sad because she couldn't go to school since 10 days. She had taken a lot of painkillers, but it was not useful. She had sudden loss of appetite. She was constantly in pain, and I couldn't get much specific physical generals of the child. So the journey, how did the disease start? Again, whenever we see any acute case, just try to know how did the condition started, what had happened before she got or landed up into this acute condition. Just try to find a cause. Just try to find any suppression, because that is again one of the most important prescriptive symptom in our cases. So a few days back, the patient had suddenly developed skin rashes, and she had those skin rashes for 3 days. So the parents, they applied some allopathic ointment, and it went better. And after 1 day, like 3 days, she had skin rashes. They applied ointment, it settled, and the child developed inflammation of eyes. Then they went to an ophthalmologist. They gave medicines. They treated the inflammatory condition of the eye. Her eye was okay, better, and the child developed diarrhea. Along with diarrhea, the child developed sudden knee pain. So this was her journey. Skin rashes, which was suppressed with allopathic treatment. She developed inflammation of eyes, which was suppressed, and the disease landed up into her joints. See how suppression goes from skin to eye, and then diarrhea and sudden knee inflammation. So, mother said that, I asked them, how did skin complaints started? And did anything happen before she got those skin symptoms? Because see, even when you observe in your own life, in your own cases, there is some cause before any disease. There cannot be any disease without any cause. As Einstein says, cause and effect. There has to be cause to get an effect, and that effect will give another cause. So we can see this in this case. The cause, what we could see was skin, suppression, effect, it went to eye. Then eye became a cause, which was suppressed, it went to GIT, and GIT, she got knee cow inflammation. So we had to find what happened before this, before skin rashes. So she said that this girl, she was just 3 years old girl, she had a fight with her elder sister just 2 days before the skin complaints. And this 2 years girl, she abused her elder sister. She used to give a lot of abusive language. She used to use slang languages, just 3 years old child. She used to be abusive. And her mother and father both expressed disapproval towards her behavior. And they said her strongly, this is wrong. This is not how you have to behave. You should not be abusing your elder sister. This is a very bad thing. And then she got very angry after that. And after that, she started abusing more. She became more abusive. So her parents said that she's usually not abusive, but whenever she is angry, she starts giving abuses to the opposite person. Just 3 years old child. So on inquiry, I asked, does her parents use abusive words? They don't use abusive words. Then about the child, they said, I inquired, so they said, this girl, she likes to dress up very well. She likes to look very good. She used to change 3 to 4 dresses in one day. She used to look in the mirror all the day and she used to flaunt herself. She used to treat herself like princess. She she loved her elder sister. She loved her parents. When anyone is sick in the house, she will take care of them. She is very helpful. She'll help mother in kitchen sometimes. She'll help her elder sister in some work. She'll help her father. But whenever anyone disapproves her, or whenever anyone goes against her wish, she becomes very abusive and she becomes very angry. And she is very devoted to her mother, sister, but she wants them to follow her instructions. Like if she says she wants her sister to sit, her sister has to sit. If she asks her mother to come out, her mother has to come out. And if it doesn't, then she will throw tantrums, she'll become abusive, and then she is not in control. She's a very possessive child, specifically to loved ones. She gets angry on little things, and she is always though she's just a 3-year-old child, whenever her father is late from work, like her father usually comes to home at 8 o'clock, but whenever her father gets late, he comes at 9:30, she's worried and she'll call her father, father, where are you didn't come? Or his mother's gone out, or sister doesn't come back to home from school, and if she's late, she's worried about her sister. Genuinely, she's worried. Sister, where are you? You didn't come. You're late. She's very caring if someone is sick, and she'll take a lot of care of people in the house. So see, we can see so much, what you call is colors in this girl. One way she is very beautiful. Second way she is very lovable. Third way she is very possessive. Fourth way she is responsible. Fifth way she is very abusive. And let us think what remedy we can give her. So this is a girl. See, she is so sick, she cannot walk, but just look at her. She'll wear this nail paint, how beautifully she is dressed, and she will decide what dress she has to wear. Her mother cannot decide her clothes. She will decide matching necklace, matching clips. She is this type of girl. You can see the inflammation of her knee. Her ESR was raised, it had become 32, and her C-reactive protein had become 21, which 6 is normal, but it is raised. So it means there is some autoimmune condition going inside her, and she could land up into arthritis maybe. So what was the totality taken for the case? So the first rubric which I took was ailments from mortification. So her mother and father scolded her, you shouldn't behave in this matter, and she felt mortified, right? So this was the first rubric selected, ailments from reproach. Reproach is when someone finds fault and tells the person directly, you are wrong, and this habit or this, your this kind of behavior will not be accepted in future. And then she got affected. So we will take the rubric ailments from reproach. This child is very abusive, though she is just 3 years old child. We have to take the rubric abusive. Again, this child is having a lot of anxiety about family members. Whenever they are late, she'll just call them, father, you're late, or mama, sister, why didn't she come from school till she's late? If someone is sick in the house, she will take care of her mother. She'll go and give water. She'll go and give water to her father. So cares full of anxiety about family members. She's a very cheerful child. Also very dominating and dictatorial. Like she wants everyone to follow what she says. Also, her complaints started after suppression of complaints. So we have to take this rubric. Ailments from suppression of complaints. And pain went to the left knee. It didn't go to right, it went to left. So we have to take into consideration pain in the left knee. It could have gone anywhere. It could have gone to the elbow. It could have gone to right knee, right angle, left. But the body decided to go to left knee. So we did a remedy at the particular level, which has affection on left knee. And just guess what the remedy is. I know, I think everyone must have just about the remedy. Ailments from mortification, from reproaches, from abuse, anxiety about family, cares full of relatives about, cheerful, dictatorial, ailments from suppression of complaints, and pain in left knee. So the remedy given was not platina, dull camera. Yeah. So I gave her the remedy dull camera because platina and dull camera are very similar remedies. And we many times skip dull camera and give platina. So I remember my first case where I prescribed dull camera to a child who had a very bad urinary tract infection which was not being treated in I think 7-8 years back. And I was amazed to see her results, and I was amazed to see this part of dull camera. And since then, I've been giving this remedy on a very regular basis on mentals to many children, and I've seen wonderful results. Dull camera 200 stat was given to the child. So she came after 2 weeks, and look at her knee. There is no swelling. It was absolutely good. This is the child, and I would like to play the video. Good. कैसी है? अच्छी. बोलो. अच्छी हूँ. क्या फर्क है पहले से सुनील जी?
पहले बहुत फर्क हो गया, पूरा मतलब कंट्रोल.
जैसे अच्छी थी पहले वैसी हो गई.
इसका पैर में सूजन वगैरह कुछ भी नहीं.
दिखाओ उसका पैर ऊपर करो.
इसका पैर में यहाँ पे सूजन वगैरह था, सूजन तो बिल्कुल नहीं है.
See, if she would have gone to a conservative mode of treatment, they would have definitely given us steroids. But just a single dose of dull camera.
कैसी है अभी इसकी?
We save the future.
बुखार कुछ आया? नहीं. चलने फिरने में आराम है?
हाँ, वो भागती है इतना, दौड़ती है, दिन भर दौड़ती, गिरती रहती, दौड़ती रहती.
अब इसी पैर पे पर भी गिरी है.
अब भी गिरी है,
बाहर भी गिरी.
So what we did with this child, we just not treated her inflammation. We did not treat her pain, right? What we did with this child was we treated the process behind the disease. We treated her at a constitutional level, taking care of her as a whole, right? So when we give homeopathy with this approach, we can see miracles in our clinic. So let us understand a little bit about dull camera child. So, the first thing when you notice about dull camera is these children will talk with air of command. They will just command her mother or father. In my clinic, I see so many dull camera child. How they talk, Mama, come here. I don't want to talk. I don't want to say this. They are so small. They are just 5 years, 6 years, and they are talking as if they are grandparents or they are prime minister of a country. They have a lot of dictatorialness and a lot of command in their talk. Also, they are very friendly children. They will easily be friendly with you. They'll talk to you. They will be a lot of help to their friends, to colleagues. They would in their friend circle, dull camera children will always be very friendly for their friends. They will always help them in their homework. They'll help them if they're sick. But when this child gets into a state of obstination, that time you will see an entirely different picture. They can become very arrogant. They start abusing, right? They will not listen. The mothers will say, my child does not listen once they are obstinate. It's impossible for us to let them follow my command. They will just do what they want to do. So again, this extreme friendliness, lot of air of command they talk with, and lot of obstination. We should think about dull camera. Again, there's a lot of anger and there's a lot of affection. So the mother will say, I don't know, doctor, about my child. Sometimes she's very lovable. She'll take a lot of care. She'll show a lot of affection. And if things do not go against her wish, she can be very aggressive. She starts abusing me or she starts abusing anyone around. I don't know why I see this state in my child. So, you have to think about the remedy dull camera. Also, one very beautiful thing about dull camera is they are very busy child. They are always active. They are participating in something. They are playing. They are cycling. They like to be active. They are not indolent children, and they always want change. They like to travel. They sometimes look like calcarea foss, right? Calcarea foss, they are like calcarea foss. Calcarea foss is a very cute child, very lovable, who like a lot of activity. They are very affectionate. They seem like calcarea foss, but when you have the element of abusiveness and dictatorial, you have to think about dull camera. They're very possessive and full of cares. So whomever they are associated with, like their mother, their father, their sister, they are very possessive. They want their parents or the best friend to just listen to them and just to follow their commands. They cannot, they cannot tolerate anyone not listening to them. Admonition, aggravation, like this dull camera child. If you just tell the child in a most loving manner, baby, don't do this, you will fall. Baby, do this nicely. They cannot tolerate that. They get very aggressive because they say, I know what I'm doing. Same like Platina, Naxwamika, Belladonna, they also cannot take slightest of admonition. Admonition is a slighted of suggestion. They cannot take suggestions. They get angry, they get aggravated on suggestions. They are very abusive children and they can become very violent if things do not go against their wish. They can throw away things, they can break things, they can become abusive. And when they get a lot of anger, they weep. And the landmark symptom of dull camera is change of weather aggravation. So whenever we know there is a change of weather, like from hot to cold or cold to hot, these children's complaints aggravate, specifically the respiratory complaints. They are very overactive children. And one beautiful symptom about dull camera is diarrhea when they stand on wet floor. So, many times mother will tell, I don't know, doctor, she goes to the bathroom, her legs get wet and she gets aggravated. So we have to think the remedy dull camera. Diarrhea when standing on wet floor, diarrhea after getting wet. Other remedies are like dull camera, rustox, calcarea, aconite. Asthma alternating with eczema. So this is again a very important symptom where if you get a history of suppressed eczema and patient lands up into asthma or cough. So whenever he is coughing, his skin is okay. And whenever his skin is aggravated, his asthma is okay. So you have to think of the remedy dull camera. Cough alternating with eruptions. Other remedies are arsenic, mesarinum, sorinum, and sulfur. Again, pains which are aggravated in wet weather, pains in lumbar region, and his complaints are better by walking, better by warm, and better in dry weather. Wet weather is their enemy. So we have to sum up with dull camera. Just remember, someone like Platina, someone like calcarea foss, someone like palladium. Combination of all this with lot of abusiveness, lot of obstinacy, think of remedy dull camera. And I hope with this understanding of dull camera, you all will definitely try to see a child from this point of view and prescribe dull camera, because it's a very good child remedy. We skip in our practice. So let us go to our next case. Again, it is a case of high grade fever with leukocytosis and raised C-reactive protein. So this child was 3 years old child, and he had consulted with his parents. He was again having high grade fever, temperature was rising up to 103, 104, and his fever was coming every 4 to 5 hours. So, this child was coughing in my clinic, and there was a lot of perspiration seen. He was sweating and he was coughing. So this is something strange, I observed. So I took it as a symptom. Coughing is accompanied by perspiration. So I confirmed from his mother, does the child perspire even at home when he's coughing? So mother said, yeah, since he has got this fever and cough, he's just perspiring with cough. And there's a lot of salivation when he's coughing. So in my clinic also he was coughing. There was a lot of perspiration and a lot of saliva drooping. So his mother was carrying a handkerchief. So also when the child was coughing, he was just holding his chest, a lot of saliva and a lot of perspiration. So these things we observed in my clinic. So this child, since he is having fever, he has become very restless. So his mother was telling me, doctor, I don't know what has happened. Since the child is having fever, he has changed. I said, why? What happened? Well, he's whenever the child is having fever, he becomes very restless. And whenever he is in a febrile condition, he goes and hits his younger brother. Like what he does, he'll go and hit him, he'll bite the younger brother, and he'll start making some jokes, just make different faces. He'll start teasing my younger brother, he'll start teasing his grandfather, he'll start teasing my husband. He just teases everyone when he is not in a state of fever. He will not obey anything. So like when he is in a state of fever, he will just sit, he's perspiring, he's coughing. And when he is not in a state of fever, he is very restless, he is joking, making faces, he's teasing everyone around the house, and he's not obeying to instructions given by parents. So if the parents are telling, do not go out in air, he will go out and play. If the parents are telling, do not drink cold water, he will go and drink cold water. If the parents will say, don't sit down on the floor, come and sit on the bed, you will fall sick, he will sit down on the floor. He will not listen. And his mother was fed up. And he gets angry whenever her mother shouts at him or anyone shouts at him, why are you behaving like this? He gets angry, he will go and sit in the corner and sulks. He'll just sit this way and he'll observe everyone. So his cough was aggravated at night whenever he used to lie down. And I asked the child to walk in my clinic because I usually, as I said, there are certain things which I ask the patient to do when they are in the state of cough. So I asked the child to walk. So whenever he was walking, he was coughing, and he was standing, his cough was okay. His cough was aggravated after 2 to 3 a.m. and there's a lot of perspiration and salivation. So the observation which were made in the clinic were, again, as I said, the child was very restless in the clinic. He was just sitting from one chair, he was going to another chair. He broke my one chair, though he was having high-grade fever. There was a lot of salivation when he was coughing. Patient was holding both the chest when he was coughing. And when I asked the child to lie down to auscultate him, he started coughing very badly. So again, that was an important observative symptom, coughing aggravated when lying down. So these were some of the observations made in the clinic. And you can see his leukocytosis. His WBC counts were 23,100. So his platelet counts were 5,35,000. And his parents were very scared. I was also scared. His C-reactive protein was increased. It was 14.4. It is normal, usually below 6. C-reactive protein means there is some autoimmune condition going in his body. And his SGPT has again increased. It was normal, sorry. So C-reactive protein had increased. His WBC counts were 23,000. And they are strong believers of homeopathy because a lot of cases are treated with homeopathy, specifically the acute. So I'm very thankful to those patients who just bestow their whole faith on me and give me this opportunity to treat their children in such acute cases with homeopathy. So the rubrics which were taken were cough night, midnight after 2 to 3 a.m. Cough night with perspiration. So we observed there's a lot of perspiration during coughing. Cough was after midnight. Cough accompanied by salivation. Cough holding chest with both the hands. Child had to hold his chest when he was coughing. Cough, lying down, aggravation. Cough, walking rapidly, aggravation, sulky. So as I said, whenever anyone shouts at him, he'll just go and sit in one corner and he'll sulk. Right? So this is important disposition which we have to observe in the case, and contrary, we have to take this rubric, because since he had this fever, the child was not listening to the commands. He was wanted to do opposite whatever was said by the parents. So we need to take this rubric, mind contrary. Do not listen what they say. If they say to go right, he will go left without thinking. So remedy was given Merck salt 200 stat and followed by Saclac. The patient was advised to give follow-up after 2 days. So the child came after 2 days. So this child was very, as I said, he was a very disobedient child. So he was scared of needles, of blood. So he was not going to the blood checkup thing. So I said then we'll go after a week. We'll not force the child. But after giving mercury, the next day, there was a lot of cough coming out again, but the interval of fever had come down. And gradually after 3-4 days, this fever was like just once in 24 hours, that too it was around 100. So that was again okay. That was a sign for me, the child is on the right track. And on 11, after 1 week, I got his WBC done, which had come down to 11,300, and the C-reactive protein came down to 5. Just with 1 dose of Merck salt. So we can see the reports with the red marking. His WBC counts have come down to 11,000, and the C-reactive count has come down to 5. So why I'm showing these cases, or what I want to tell here is, whenever we treat a child, you have to observe 2 things, not just the symptoms. Why the child felt sick and how is the child responding to the sickness. These 2 things are very important, specifically when we treat pediatric cases, because they do not know why they fall sick. They do not know why they are, what are they going through. So we have to hunt for these 2 things in your clinic whenever we are treating pediatric child. So I'll just share one case with you. This was a case of pyrexia of unknown origin. So this girl, she was just 5 years old and she was having fever since 8 months. She was of hospitalization. There was no cause found. So she had started getting fever in the month of October, and they consulted me around in the month of April, May maybe. And I took the whole history, and they said, like, see, we have gone to this hospital, that hospital. Every time we get admitted, her fever goes to 103, 104. And there is no change. We just now are giving her paracetamol. So doctors have said, don't get her to the hospital. There's no cause for the fever. You have to be with it. As long as she is not getting the fever, just give her paracetamol. But it's been 6 to 8 months. This child is having fever frequently. Once in a week, she ends up into fever. And then when they give paracetamol for 3-4 days, she's okay. Again, after 3-4 days, she again gets fever. So this was a thing happening with her. So, this child was very cute. She was very silent child. She was just talking to the parents. So she was just listening. She was very vigilant. She was trying to observe everything. But I didn't notice she was observing everything. She was a very cute child. So I just asked her parents, this child is having fever since October, right? So what was happening in her life or in your life in the month of September or October? So the parents said, nothing, everything is okay. So this child, just 5 years old child, she started crying. She couldn't weep completely, but she just started sobbing. And she said, my parents were getting divorced. They were fighting constantly. And her parents were astonished to listen her statement. And then I asked them, is it correct? Then they said, yeah, we had a lot of fights in the month of September, October, and we decided to get separated. And see, since then the child is having fever. And the parents did not realize that this is leading to fever in this child. So, sometimes we just, take our children for granted. We think they don't understand emotions, they don't understand feelings. And whatever we are doing, the children don't understand that. And we just try to behave very differently or arrogantly with the child or other people. The child does absorb these things. And this child was given magnesium muriaticum because there's a rubric, ailments from discords between parents. So this child, uh, in this situation, she spoke up boldly to me. Yeah, they were getting separated. She was crying, but she was not weeping very badly. Okay. And then that decided me to give magnesium mule, because if she would have been magnesium carb, she would have wept very badly in front of me. She would have asked for support, but she did not. She was a very silent child. She was a very matured girl. She was taking a lot of care of parents. She was caring her younger sister who was just 9 to 10 months old. So magnesium muriaticum did wonders for her, and gradually in 1 to 2 months she had no episodes of fever. So, whenever we prescribe for pediatrics, we have to understand how the child is reacting to a problem. Any problem, be it a suppression of any disease, be it any emotional issue happening, because this uncompensated reaction will lead to a remedy. Like as we saw in dull camera, she reacted with a lot of abuses. She reacted with a lot of tantrums, right? So we thought of dull camera. This magnesium child, he became, he just withdrawed himself. He couldn't express. He kept his all emotions inside, but he expressed through fever. Now, what is fever? Fever is a situation when a child gets fever, both mother and father, they take a lot of care. They become one and they take care of the child. So somewhere this child was trying to pacify both parents through the event of fever. So you have to understand these little things in our cases about the children. So, there is a biologist, Bruce Lipton. So he made a study and he said that, our thoughts, our emotions can control our DNA, right? So there's a very good study of this. He said that mind controls the genes and thoughts can change the biology. So the way we are thinking, the way we are reflecting our emotions, the way we talk to ourselves when we are not talking to anyone will determine our health status. So we have to be very careful every moment what we are talking to ourselves, because that's most important, because the very talk we talk to ourselves, we are changing our biology. So see, now all three cases I must have shown, and in these three cases, we do not have to forget the fundamentals of homeopathy, because homeopathy is not just meant to control fever. Homeopathy is not just meant to control pain. Homeopathy is not just meant to get the counts down. Homeopathy is beyond these things, and we do not realize that. Even the antibiotic can get the fever down. So why we have to rush to get the fever down? A painkiller can get the pains down. So why we have to worry about the pains, right? What we have to worry is something which is below the pains, something which is below the fever, something which is below cancer. And what is below that? Below that is a process which the person is going through, a disease process where he is not able to break the tendency of a disease. Why he is not able to break the tendency? Because mentally, emotionally, he is going through some conflicts. He is fighting some conflicts, and these conflicts he is not able to resolve. So once we give a remedy on the basis of similars, trust me, they will try and help the person to break the conflicts. This conflict will help to break the tendencies, and these tendencies ultimately will take care of the fever, take care of the pains, or take care of any disease. So don't rush behind just controlling a disease. We are far beyond allopathy. We are far beyond modern medicine, they still don't know what we are doing, but we can do something what they cannot do. We can break the tendency. So we can only do that by applying the fundamentals of homeopathy, which is law similars. Concept of individualization. Concept of individualization, we all know how one person is different from another, how one disease is different from another. So when we are able to apply this concept of individualization in every case, we will be successful as a correct homeopath. When we will understand the effect and reaction relationship. Obviously, when we give drug in a most dynamic state, single remedy and minimum dose, and with these all, we promote self-healing in the patient. So when we apply these things, we can see really miracles. So, every disease is caused by a conflict or a shock. So this conflict or a shock, for example, for Natrum muraticum, his conflict or shock is a broken relationship. For a pulsatilla, her conflict and shock is not getting attention, being neglected, right? For Ignatia, a conflict and shock is not getting that self-respect, not getting that emotions what she wants. For Mercury, his conflict or shock may be injustice. He felt injustice. So every person, before a disease, he goes through a conflict or a shock. And every person, depending upon the remedy they are, depending upon the constitution they will respond in a very different manner. So different, this response we have to study, which will help us to go to the remedy. Again, our reactions depend upon our past experiences, our vulnerabilities, what are our weaknesses, our individual perception and belief and values. And that again depends upon you as a constitution. So for a Natrum, if he has a money loss, it won't bother for him. But if he loses a friend, that will be bothered. For a Bryonia, if he loses a relationship or if he has a divorce, that will not bother him. But if he loses money in the process of divorce, that will bother him. So everyone has different weaknesses and we have to catch hold of those weaknesses. So I'm going to just share this case of HELP syndrome, which I presented in Liga. So this case is a HELP syndrome case where a woman approached to me in 8.1 week of gestation. So what is HELP syndrome? So HELP syndrome is a condition in which a person's hemoglobin goes very low, his platelet counts drop down drastically, his all liver enzymes are elevated and PPNR are dancing. So in this situation, usually no one goes for complete the pregnancy because there's a high risk baby. There are chances that the baby will not survive till 9 months. Secondly, the women have to take steroids because in this situation, mostly the baby's lungs do not develop. And if the child's lung is not developing, even if they are given birth, they will die after a few months. But unfortunately with this woman, she was with HELP syndrome, but her platelet counts were very low. And because of that, no hospital was ready to admit her because her platelet was low, hemoglobin was low, and there was a high mortality rate for that female. And all hospitals were like, sorry, we cannot treat you or we cannot do your abortion. So she approached me because there are many patients in during their pregnancy, they take homeopathy with me, and I've seen beautiful results in them. So someone referred her to me, and her bilirubin count was 1.37, SGOT was 83, SGPT was 78, PTINR was 18 and 1, HP was 9.5, and her platelet count was 53 lakhs only. And just imagine, she's 8.1 weeks gestation. She had a lot of pruritus. She complained of itching of all the body. We have just 20 minutes left. Okay, she had pruritus, itching of whole body, and 7 months back this female had dengue. Her father died of hepatocarcinoma. Her appetite had decreased, sudden nausea with increase, specifically this nausea increased during and after eating food. She desired curd, juices, fruits. She had strong aversion to sour things. Bowels were unsatisfactory. So the patient had itching all over the body 3 days back and with a lot of chills. And whenever the patient had covered herself, she felt better. There was a lot of nausea with the itch. So her itching was aggravated in the afternoon due to sleep and when undressing, and it was better with occupation and when scratching. So she went to the gynac. So her gynac did some blood test and then she said, I'm sorry, we cannot admit you in my hospital. She went to another hospital. There also they saw her reports and they did not want to admit her. Then they came to me and I saw her reports and I said her, "Ki just give me 1 week. If I'll give you a medicine. If this medicine takes care of you in this 1 week, then only we will move ahead. Otherwise, I will not go ahead with the case." So her sleep was disturbed due to each dreams of dead relatives. So the mental and life space, this patient was, what do you say, she was very control freak. You know? She wanted all the things in her house to be placed properly. And whenever she sees any disorder, she used to get irritated. And whenever she was angry, she used to hit her children like anything. To that extent that her children and husband were scared to go near to her. So this was her nature. She had a lot of anxiety and anticipation about the future. She had a lot of fears like ghost, fear of dark. She couldn't stay alone at home. She always needed company. So 2 months back, her brother died. He met with an accident. And since then, she had developed extreme fear, since as if someone was standing behind her. So her brother's death was a very shocking thing for her because she was very much attached to him. Her brother was like a fatherly figure. He was a very supportive system in her life. So by like we'll go to her childhood history. She was a dark complexion skin girl. Unfortunately, in India, this thing is given a lot of importance, and she is one of the victim of that. So her skin was a little dark complexion as compared to other siblings. So her father never introduced her to any of the relatives coming to the house or any of his friends coming to the house. His father never took her out to gatherings and she felt unloved by her father. And her elder brother always supported her, always said her, "You're beautiful, don't worry, father is doing great." So she felt unloved by her father and she got all her support and care from her brother. She was very shy and she never demanded anything. So all this happened till she got married. Again, unfortunately, after getting married, she felt unloved by her mother-in-law because the patient's sister-in-law was fair, and she always felt her mother-in-law is comparing her with her sister-in-law, and she again felt unloved. And eventually, she developed that no one loves her. So this was conflict which was running in her. No one loved her. Her brother was a support. She was very irritable. She was very angry. She was violent. She was very fastidious. Whenever she used to get up in the morning, she did not like to talk to anyone, not even to her children. Like in the morning, she used to just make tiffin of her husband and her children. She used to just give them, and they used to go. And then she was okay. And in around noon, she was okay temperamentally. And then she used to call her husband, "Have you reached the office?" But never in the morning. She had a lot of anxieties and fears, specifically when she goes to night. She couldn't sleep at night. During her sleep, she was very restless. She kept on tossing in bed. Any slight emotions and caused a lot of palpitation. And then she used to go out in balcony. She used to stand and she used to feel better. Her husband described her to be a very irritable person, and her husband and her children were scared to talk to her because her mood was very repulsive. She's a fault-finding woman. a very hardworking woman along with that, and she always likes to be busy. Physical examination, she was pale with yellow sclera. She was a multigravida, one history of one abortion. So let us analyze this case. So in this case, what we see that the person presented with a lot of irritability, lot of anxiety, anticipation. She was repulsive temperamentally. Patient had lost her brother 2 months back, and since then she developed a lot of fear. Patient is very sensitive to any bad news. Specifically, she is very scared to be alone at night. Not a single night she can stay alone. Patient always dreamed of her relatives. Itching aggravated by undressing, better by scratching. She had nausea. So these were some important analysis which I did with the case. So conventional diagnosis was HED syndrome. This is a very rare disease. So rubric selected for this case was irritability ameliorated in open air. Her mood was repulsive. So as her husband expressed, we are scared to talk to her. We do not know she will burst temperamentally. So we have to take that as a rubric, mood repulsive. Indisposed to talk. Woman, she never used to talk in the morning. She doesn't like to communicate with people. So we took as indisposed to talk. Fear something bad will happen. This is important because this of lately she had developed these fears. So it was very important for me to take it in a case. She had a 4-second feeling by loved ones, by her father, now her mother-in-law, and somewhere she felt maybe her husband doesn't like her because of her complexion. She had itching, which is aggravated when undressing, better by scratching, and nausea. These were some of the rubrics. So these were the rubrics collected, and the remedy was very simple. See, when we take a rubric, we put the rubrics in a repertory chart, but we have to understand these rubrics are just mechanical thing. They are just obeying our command. Behind every rubric, we have to understand the emotion. We have to link all the rubrics together, and we have to make a beautiful chain out of it. So just taking irritability, mood repulsive, we have to understand why her mood is repulsive, why she is indisposed to talk, because somewhere she has a lot of 4-second feeling. She's not demanding love. Instead, she's become more repulsive. She doesn't like to talk to anyone. She has a lot of 4-second feeling. We have to understand emotions behind every rubric. And when we try to do that in every case, what we see is we are getting a good picture of a remedy even after we repertories. So maybe the remedy may be the 4th, maybe 2nd, maybe 5th. But when we understand a person behind the rubric, we will be able to judge that thing and rule out the remedies which we do not intend to give. Like for example, at first I thought of giving arsenic, but arsenic was ruled out because the patient for arsenic, the patient is very suspicious, very insecure person, but his suspiciousness and insecurity is not because of any emotional need. So for her, her need was more emotional. For her, though she was restless, though she was fastidious, though she was anxious, but the cause behind was rejection. She felt rejected. She felt isolated. But arsenic will not feel that. Arsenic is restless, fastidious, anxious because he's a control freak. That is the cause behind him. He doesn't trust other people doing things. That makes him more restless. But she was more restless and fastidious because of her emotional lacuna. So I ruled out arsenic. Phosphorus was ruled out because whenever a phosphorus patient feels he's not getting affection, he will demand for it, or he will give more affection to get affection. But she was not demanding. She was just being repulsive. She was being more angry. She was being more rude. So phosphorus ruled out. So the central line of the patient was she was not loved enough. She felt unloved by her father, mother-in-law, husband. That thing led into a lot of repression of being unloved. And that feeling that I'm not loved, and she couldn't express that feeling to anyone. This eventually at subconscious level landed up into a lot of anxiety and anticipation. So her anxiety and anticipation was because of unsolved conflict regarding her repressions. Her unsolved conflict regarding I'm not loved enough. So the remedy I decided to give was magnesium, of which I was like wondering, should I give magnesium carb, magnesium mure, magnesium sulf, but I decided to go for magnesium carb because magnesium carb bonds support, and her support system, her brother, she lost him, and that broke her down very bad. So the medicine given was magnesium carb 200 stat. Okay, and the patient was managed with homeopathy. And to my surprise, when the patient came first on 3rd February, her platelet counts were 53,000, her hemoglobin was 9.5, SGPT OT was 83 and 78, and bilirubin was 1.37. Exactly after 7 days, her SGPT OT came to normal side. SGOT came to 39, SGPT came to 42, her bilirubin dropped to 0.86, and her platelet increased to 75 lakhs. So this was a good sign that the vital force has been stimulated and it will take care of her. So the patient decided herself, I want to continue with the pregnancy. So I said, okay, we'll do her test maybe after every 15 days. And she was monitored after every 15 days. And eventually in 1 month, I could see that her platelets came back to normal. Her bilirubin counts were maintained. And she was just on Saclet. Just at 7th or 8th month, this patient took some medicines. Like I think she took hematics, okay, and calcium. As she took those medicines, again her itching increased. She was asymptomatic for 5-6 months. And just after taking those medicines, she started itching again. So I had to repeat the remedy magnesium carb. She again settled down, and I advised her not to take any medicines henceforth. And this lady had a very normal delivery. Usually these cases cannot go into a normal delivery. She had a normal delivery, and her doctor said go for normal delivery. She said, I want a Caesar. But doctor said, no, you will get a normal delivery, don't worry. And she was very happy. And she was more happy. She said, my child is so fair. I'm so happy. This has completed my lacuna. So the remedy given was magnesium carb. In short, this is a follow-up.
मतलब जब भी डिलीवरी मतलब शुरुआत होता है मतलब पहले महीना 1 महीने के बाद खुजली चालू होती है, खुजली ज्यादा तेजी से मतलब थोड़ा स्लो होगा फिर तेजी से होती है। तो डॉक्टर बोले सब लोग अभी मतलब रखो बच्चा, तो मैं सफाई कराने चली गई थी। तो फिर उसके बाद आपकी इधर आई तो होम्योपैथिक दवा 7 महीने तक नॉर्मल था, कुछ थोड़ा भी खुजली नहीं हुआ, अच्छे से खाना पीना भी सब खा रही थी। 7 महीने के बाद तो चालू हुआ तेजी से। तो आपका दवा जब पीती थी तो कम होता था, फिर कुछ दिन कम रहता था, हफ्ते भर, फिर उसके बाद तेजी से बढ़ता था। फिर आपका दवा लेती थी तो फिर कम होता था, मतलब चढ़ाव उतार होता है। मतलब पंडित जी चला जाए पैसा में तो बताए आपके बारे में तो ध्यान दिया है। बार पूरा मतलब 4 महीने तक परेशान रहती थी, 4 या 5 महीना, 4वां महीना खत्म होते होते खुजली चालू, और पूरा डिलीवरी तक पूरा खुजली रहता था। कोई दवा नहीं कोई काम सूट करता था, अंग्रेजी दवा नहीं सूट करता था। कम हो गया था इसका, लगना चालू तभी बच्चे का वजन बढ़ा ना, तो जाती नहीं। आपका जब दवा खाई तो भूख भी लगता था, नहीं खाती थी तो भूख भी। हमको लगता है आपके दवा से ही इसका वजन बहुत फटाफट बढ़ा, इतना वजन बढ़ा, मतलब मेंटेन रहा। इसका भी वजन नहीं बढ़ता था लेकिन इसका वजन मेंटेन रहा। इसको तब देखिए कि कैसा कंडीशन हो गया था, पूरा एकदम पतली हो गई थी, कंडीशन खराब हो गया था। मैं सोच रही थी कि नॉर्मल में बच्चा नहीं पैदा कर पाऊंगी। मैं बोल रही थी मेरा ऑपरेशन कर दीजिए, मगर मैं बोली नहीं नॉर्मली बच्चा होगा। जाते लास्ट तक मैं बोली मेरा आप ऑपरेशन कर दीजिए, बोले नहीं नॉर्मली। आपको पहले दूसरे महीने में तो सबने बनाई चाहिए, आप बात करके देख, सब कुछ नॉर्मल है, सब बढ़िया है। अभी तो डॉक्टर साहब को भी दिखाया, बहुत सुंदर है।
So this was a follow-up after.
नाम बताइए।
So magnesium, like Dr. Prasad, I think we are running out of time. In 5 minutes, I'll have to wind up, right?
I
So,
think no need to, ma'am. If you have any cases, then you can go. No problem.
okay, fine. So, magnesium child, basically, as I said, one more child about magnesium child, they need a lot of love, they need a lot of security, and they need a lot of affection, because they have a central feeling that they will not be accepted, right? But they will never demand those things. They will never demand love like phosphorus. They will never demand security like calcarea. They will never demand affection, or they will never demand recognition like sulfurs and acceptance, etc. But they want all these things. And whenever a magnesium child's childhood goes with a lot of fights between his family, his parents, then somewhere they start, uh, feeling very lonely. They start withdrawing themselves. Okay. And they don't even know they want love. They don't even know they want security. And all these feelings of theirs goes into a subconscious level, in their subconscious mind. And when they get into the subconscious mind, these patients become very anxious and nervous. And we wonder why this person is so nervous. They can be nervous to an extent of urgentum. Like I've seen so many cases where I thought I'll give this patient urgentum, but I get some history, I gave him magnesium, and it worked beautifully. They can be so nervous and anxious, but you have to just hunt what they did not get, but you will never get because they did not know what they want. They cannot tolerate aggression, and they are the one in the family or a group who will be always sacrificing, but they will never show. And people usually take these children for granted. Many magnesium children, they have many children who have LRTIs, any strong infection, disease, just, and if you see this child very lovable, very cute, very obedient, just ask, is there any fight going in your family? And just see the response of the child and parents and hunt for magnesium. Trust me, by giving this remedy, you can get set and fill that lacuna or vacancy in the child which he is missing in his life. From a distance, they may seem very shy. They are not interested in anything. They may be weak in studies. See, this magnesium I'm talking are those who are suffering from any fights in their family, who are suffering from any neglection in their family. But if they are not and they have a very healthy family environment, they can be outstanding children. They can be very open, they can be very helpful people, they can be very confident children, right? Till they don't go into a state of depression. They have a lot of forcing and feelings, specifically when they feel they are not loved by their friends or family. And they cannot tolerate disharmony, they cannot tolerate any fights. In a group also, just ask a person, like whenever there's a fight in the group, what role do you play? So he will say, I just try to pacify them, I just try to solve the conflict, because I cannot see people fighting and they are getting separated. I cannot just tolerate that. So my role is just to pacify the fight. They cannot tolerate disharmony. So there's a rubric harmony desire for in our repertoire. So remedies like magnesium, rutha, natrums, these remedies come into this rubric. So benefits of classical homeopathy, we have to remember is we are not treating the symptom. We have to not to run behind treating a symptom. We have to treat the process. We can do something much beyond what an allopathic doctor can do. I'm not telling them they're good or bad. That is their limitation. This is our scope. So we have to work on our scope. Our scope is to treat the process. Our scope is to treat the tendency of a disease. And we have to work in our scope rather than trying to make their scope our scope. Everyone is important. Just we have to recognize ourselves. So we all know that when we take a case taking according to Organon, we have to individualize every case, right? And to individualize every case, we have to be free from prejudice. We have to be a balanced person, sound senses. Again, sound senses is very important, specifically when you treat pediatrics or coma cases, because you have to work on observation. And fidelity in tracing the picture of disease. You have to be very accurate when you take a disease. How did it progress? How did it start? Was there any cause? Sometimes you will not get any cause in a child during his, since he is born. Then you have to hunt for a strong cause in mother's pregnancy history. And definitely you get some very strong cause. And that conflict which was going in her mother definitely affects the child, and this child gets sick. So this is one of my most favorite footnote and aphorism, and just I request everyone to today or tomorrow go to your Organon aphorism 90, study footnote 85, where Hahnemann says, when a physician has finished writing down particulars, note what he observes. And trust me, in my case paper I don't have right now, I've kept a separate section on observation. So I just note down the observations. Patient is restless, patient is VP, he has perspiration on his nose, his lips are pink, or his lips is bluish, the skin eruptions are like this. You have to observe that. And in footnote 85, Hahnemann talks beautifully about observation which he has done in his clinic. So he says, just look at your clinic patient. How is he? Is he very drowsy when you're trying to talk to him during his acutes? Is he very impatient? Is he very arrogant? How he talks? What is the color of his stool? What is the color of his expectoration? Take it into notice, because they become the most important part of your prescription. Okay. Now, how can we have healthy children is a very good question which many parents ask. So now we have to remember one thing as homeopaths, and we know that health is not just absence of disease, but it is a balance of mental, physical, emotional, and spiritual being. And trust me, homeopathy gives a balance at all this level. It gives a balance at all this level if we apply according to Organon, if we approach classically, if we understand the process which the person is going beneath his conscious mind. When we trace that and give the remedy, definitely we can get that balance. So the health of a child is determined right from the moment of conception. You know, right the moment when there's conception, what is the state of mind of mother? What is the state of mind of father? Their thought process will determine a lot about a child's health. Now, quantum physics. Till few years back, we believed what we could see, but now the science have changed. Now, science says there are certain things which is beyond what we can see, what they have labeled as quantum physics. So, quantum physics is that part of science which resonates with homeopathy, which says our every thought, every emotion will create a vibration, and that vibration influences our own health and the people around. So the moment parents are going to have conception, there's a conception, what thought process a mother has or a father has will determine the quality of sperms, right? That is why in India, we go for, in our ancient culture, we always see that before a girl gets pregnant, they go through some process of meditation, or how to self balance yourself, because these things matter a lot. So right from the state of conception till whole pregnancy, environment of mother, what thought process mother is carrying, that will determine a healthy child. And health is not only presence of both arms, both legs, brain. Health is not just presence of proper organs, but it is beyond that. When a child is more emotionally balanced, when the child is not a destructive child, he is also a healthy child. So our aim has to be that the child which is born is healthy at all the levels. Because mind is the biggest force in us, and mind talks through body. There's a connection between mind and body. So every moment our mind is talking with our body. Every thought we are giving will determine what our cell will become. And mind draws all the energy. when we are thinking negative and we fall sick. So every child has some needs which we don't understand. We just take our children for granted. We don't know a child can need respect, a child can need importance, the child needs to be included in family, the child needs to be accepted, the child needs to feel secure. We bypass these things. We just either we don't include our child into ourselves, or we include him so much and make him center of our world. So we as a parent have to be more balanced, right? uh, we have to first of all not make the child feel he's center of our life. At the same time, we have to show him a lot of respect, we have to show him included, we have to show him accepted and secure. Because if the child doesn't get, if it's a sulfur child, if it is a platina child, and if you treat him badly, his respect is affected, he will fall sick. Or if he's a magnesium child and is not included, all his life he will never feel included. Even though he will get best of love in his life or by his children, he will never get included, because the formative part of a person is very important. If the child doesn't feel secure, and if he's a calcarea, a strontium carp child, he will feel insecure all his life. So we have to see to it, we have to fulfill child in all the levels. We all know the components of human body, and understanding a case, observation is very important. And observation is not just what to see, but to look into. It's a non-verbal communication which we have to understand the art. We know observation helps in rubric selection, final determination of remedy, miasmatic understanding of case. So there are many kind of children in our practice. Some children are very timid, like umbra gracia. Some children are very bold, like sulfur, like chocolate, like opium. Some are very lovable, like dulcamera, like calcarea phos. We have to understand what kind of child we are seeing in a clinical practice. Some are very responsible, like natrums, or who are not responsible, like tarantulas. They are not much responsible children. Some are introvert, again, like magnesium, extrovert, like sapias, sulfur. Some are very dominating, like dulcamera, lycopodium, sulfur. Some are very mild, again, like silica, yielding, like silica, pulsicula. So we have to understand the child. When you talk to him, you have to understand these are the few things. There are many other things. So I'll just tell you a nice understanding of Graffitis child. I think so I can take next 10-15 minutes, or we have to finish
Yeah.
it.
No. You can take, ma'am. No problem.
Okay. Fine. So Graffitis. I'll just start with a case of mine. There was a child who had consulted me for, he had, uh, I think he had repeated diarrhea. He was having diarrhea since many years, like since 2 to 3 years, and repeated diarrhea ho raha tha usko, and he was not getting better with any treatment. So on inquiring, the child was very disrespectful. The way he was sitting in my clinic also could show that his body language was very disrespectful. And the mother said, like, I don't know, doctor, whenever we say anything, like we tell him whenever he makes any mistake and we point out at him, at his mistake, he starts laughing. He doesn't show respect to anyone. I gave him tarantula or myrrh. These are the remedies, and it didn't help him. I followed it for 3 months, 4 months. I couldn't help him, and I lost the case. And just after that, maybe 1-2 years back, I was studying the remedy Graffitis, and to my surprise, I could see that this child could be Graffitis, because Graffitis as a child, they are very, very disobedient children. They will tease everyone. And there's a very strong rubric about Graffitis, laughs and reprimands. Whenever you will show their mistake, whenever their faults are found, like they don't do your homework, they don't keep their things in proper place, and whenever mother says, why didn't you do this, he will just laugh and go. And the children, if he's fat, he's chilly, the child has tendency to constipation and history of skin affection, think of Graffitis. because we skip this remedy for MERS, we skip this remedy for tarantulas, but he can be a graphitis or tuberculin. So disrespectful child as a child, and they have history of skin affections. These children, see how we differentiate from Merck and other remedies is graphitis child doesn't like change. You know, whenever they go to school, they are forced to go to school, they are forced to do homework. They will not do themselves because it's a carbon. Carbon is slow, carbon is not fast, they get tired easily. So these children do not like change. They do not like to change their house. They do not like to go to their uncle's place. We see them very irritable and prostration in children. Very few remedies you this rubric, prostration in children. They are always tired children. Like Baratacap, Calcarea Fos, Carbo Veg, Calisbicata. Mother will always complain, doctor, what to say? My child takes 1 hour to write a homework which can be done in 10 minutes. He doesn't like to go out and play. We'll just sit and make fun of everyone. He's always constipated. He is very rude. He is very disrespectful. You have the rubric insolence. Then you can think of graphitis. One very beautiful symptom of graphitis is pedinous abdomen in girls during puberty. Other remedies are calcarea card and lachesis. So their abdomen is like, it's hanging in their puberty age. But they're fat. Their metabolism is very slow, right? They look so much like calcarea, but very disrespectful, very disrespectful. So you have graphitis. A very special skin eruptions they show milk crust in newborns. Also, their skin, we know, whenever they have oozing, with the oozing, when the ooze dries, they look like golden deposits. You have to think of remedy graphitis. This is about graphitis in short. Rustox. Now, in short, I'll talk about Rustox. Rustox is one of the most anxious child. Whenever in a child I feel he is very anxious, I with Argentum, Jaysingpur, I think of Rustox because they are very anxious. They are very restless children, but they are very happy-go-lucky. Okay, they are very religious. Argentum will not be that religious as compared to Rustox. They will have easy, inclination towards God, praying things. They get attracted to such things. Their, their speed will be very fast and they're very nervous children. This is in short about, I have a lot to speak about, but I'll just rush up with things a little bit. Natrum children, we know the most important thing when you have to think about Natrum is the rubric precocity. Specifically, it is emotional precocity. I remember a child, she had vitiligo, and on taking her full case, I just got a very beautiful thing. Her mother said, my child is always curious. I said, what your child is curious about? See, whenever mother says, my child is curious, you have to ask, what is the curiosity about? Because what the curiosity is about is the remedy. So they said, yeah, my child is curious. He always keeps on asking, Mama, why people are suffering? Why he's handicapped? Why he doesn't have money? Why my auntie is suffering? They will always be curious and sympathetic towards animals and suffering of others from very small age. They are emotionally very precautious. They take a lot of care of their family, of her mother. And you will see a typical emaciation of neck. The neck will be thinner. And they are always well dressed. I will not say they dress like dull cameras or they dress like platinas, but they are very decently dressed. They like to help their parents. They are very helpful siblings. Whenever they are hurt, they will never express. They will just keep it to themselves. Whenever they are hurt, the child will seem to be very sad, but he will never see. You will see a sadness in the child. So you have to just understand why the child is sad, right? They are very well behaved children. They are not like other children who will just get into the clinic and touch your your sofa, your chairs, your stethoscope. They are very well behaved children, and you would love to have them in your clinic. They need a lot of affection. Again, they will never show it. They desire salt. Carcinosin is again something like natrum, but carcinosin is a very beautiful child, beautiful child, and she needs perfection in everything. Her homework will be perfect, her books will be perfect, her way of talking will be perfect. She's like a princess. Everything has to be perfect. Like whenever you see a child and you feel, is she a princess? The way she sits, the way she talks, the way she dresses, the way she keeps her things. There is beauty and perfection. There is aristocracy. Think of carcinosin. They are not egoistic and they can easily be dominated. So these children fall sick specifically if one of the parent is very dominating, but they will never express that. They are very sensitive to reprimand. They are very sensitive to any fault if anyone finds out. So in order that no one should find out a fault, they try to be very perfect. This leads to a perfection. Like how princes are. Like, I represent my family, I represent my kingdom, I cannot afford to be showing any mistakes. So they try to be perfect, they try to be beautiful, they cannot be egoistic. They have a history of domination, but will mold. They will love nature, they will love seashore, they desire chocolates. They have inclination towards art, dance, and music. And we always see these princes and all, they like dancing, they like music, they like art. They are very precocious, they are very shy, they are sensitive to reprimand, they have fear that they will not accept it or love, so they try to be perfect. They are very sensitive to horrible things. Anything bad happening in the family, anything bad happening around, that affects them. Even like if COVID thing is happening, and when they hear these things, they get affected and they'll keep on asking, Mama, why is this happening? Why people are sitting sick? What is COVID? What will they do if they will die? They are very sensitive to these things. Satrums and carcinosis. They feel easily insulted and they are very responsible person with good in studies. Their parents will say, we never have to force our child to study. Veratrum, also very precautious. Precautious is acting and thinking beyond the age. The child will be 5, but he will be behaving something like 20, 50. So veratrum, precocity, is more towards intellectual, not emotional. They will talk like adults with you. They will behave like adults. They will have religious inclination. They are very dominating in groups. They're very quick-minded, very naughty, and they're always the one in the group who will tease others. They will dominate. They want to be the leader, and they will tease everyone who are in the group. They are veratrums. Ophidias, we know, are very timid initially, but once they are accustomed with you, they know what you are, they try to intrude into your space. They are very, self-centered children. They want a lot of importance. There's a lot of competitiveness in them. They will always boast about, whenever they'll come to your clinic, Doctor, see, I did this, I achieved first rank. Or whenever they don't achieve first in any competition, they feel sad. They always have their own choices of clothes. They will not wear what their parents will give. They have their own choices because they are Ophelias. They can be very hurtful and quick. So we have some rubrics. Like when you see a child, specifically they are aggravated after admonition. Like if someone finds out a mistake or someone directs them, like see, for example, a girl is trying to cook and a mother comes and says, you don't have to cook like this, you have to cook like this. She feels aggravated. Carcinosin will get aggravated because she knows she is right. She is perfect, but why are they still finding her faults? Because finding a fault is the most sensitive thing for carcinosin. Medurinum, admonition aggravation because they are disobedient, but they are also very sensitive children. They also cannot take that. Affectation in children. Affectation rubric means they are like dhongi. Dhongi is what I can say is they are very pretentious children. They will be different inside and different outside. They will be pretentious in the way they talk, or in the way they behave, in the way they feel. You have to take a rubric, affectation. Ailments from punishment. You have the rubric carcinosis in lateral. So whenever they are punished in school and they fall sick, because they are very sincere children, they get sick. Child vomit milk after mother's anger. So it's a very good rubric. I had a child patient. She said her child is vomiting constantly whenever the child has her milk. So I gave one remedy, second remedy, it didn't work. The child was just 3 months, 4 months old. So I just inquired, what happens when you feed her? What exactly happens? What is the state of mind? See, I don't know. Many times I have fight with my husband. I feed that time. I feel my husband is not taking care of my child. Why I have to just take care of her? If I'm given the word, I get a lot of anger, and then I feed her, and she vomits immediately. So the remedy is valeriana. These children are very sensitive to anger. So mother's anger leads to vomit in child. You think of this remedy. And that remedy helped the child. Anxiety midnight on waking. China child has a lot of anxiety, uh, desire to be carried pulsatilla, audacious child, audacity, wandering children. Now, wandering, tuberculum, lachesis, and veratrum, when they will just come to your clinic, they'll just wander in the clinic. Like you will see through your CCTV camera, just they go to one room, they'll go and see the receptionist, then they try to get inside. Even when they come to your clinic, they'll just wander around without any aim. Because tuberculum wandering is because they are restless. They just want to move. They just need a change. So they are wandering. So we have to know why the person is wandering, why the child is wandering. Lachesis will wander because they are very suspicious. They'll have to take note of everything. Is anyone dangerous in the clinic? If can anyone hurt them? So they wander and they'll just take note of everything and every person in the clinic. And Veratrum wanders because Veratrum wants to dictate. He's just checking out things. He thinks I'm intellectually precocious, no one can stop me. Very egoistic children. In evading look, I've spoken about Basilinum children. These children are very abrupt and harsh. So if you have this rubric, abrupt and harsh in children, think of the remedy, Basilinum. So, to end up, I can say is what we miss in pediatric cases, why sometimes we are not able to give miracles in pediatric cases is we give more specifics. We rely more on parents and bypass our observation. It's very important for us to observe the child when you're talking to the parent. In my clinic, most of the time, the child is restless, crying, mother tries to control. I said, just leave the child. I want to see how he is. So I just observe him, how the child is, till which extent the child can go. Tarantula will take note of everything and he'll try to break something in the clinic. Lachesis will just take note of something. Pulsatilla will not move away from her mother. Zincum is again a very restless cell. So you have to rely on observation. You have to feel the essence of every child. You have to feel this, we cannot give a proper prescription till we are able to feel a child, feel his feelings, and feel why the child is behaving like this. Why is the child wandering? Because it's restless or because it's suspicious? Mother's pregnancy history is very important. Child's developmental history is very important. And we have to, when we will take note of all these things, we'll get a lot of confidence to treat acutes, specifically LRTI, URTI, or any infections or antibiotics. Just try to listen and observe the child. Just think like a child when you're with the child. Just be his friend. Give him a lot of attention. And just try to know whether the child is a creative, non-creative child. Connect with them. Just try to touch them and see what is his reaction. Just try to talk to them and see their reaction. Just try to talk to them emotionally and see his reaction. And most important, just try to think what made the child think sick. Was there any emotional cause? Was there any verbal cause? Was there any suppression history? What you have to find that in every case. Do not underestimate the thoughts of child. Sometimes we just underestimate thought of child. We think they are just child. What they know. Parents think they are just child. What they know. But child are like adults. They have emotions. They absorb the environment and they react according to that. They take a lot of attention. And when we talk to them, we have to give them a lot of attention and we have to have a lot of interaction. And trust me, it's worth it when you talk to every child like an adult in your clinic. So these are some of the books which I have referred, and I keep on referring for children's remedies. And this was all about my today's talk. And I'm Dr. You can connect me through my email address and my YouTube channel. Thank you so much for patiently listening to me, and I've taken your extra time. Thank you so much. Dr. Prasad?
Dr. Joyce?
Joyce? Yeah.
Okay, thank you, Dr. Shelly. So you have already won the hearts of all our participants. There are a lot of uploads coming from the participants.
Thank you.
So we are learning a little bit of running out of time a little bit.
I know.
Still, we have a session for clearing the doubts of the participants. I'll just go through that.
Okay.
Please, ma'am. So there is a question like why platina is not decided to give to a girl from Prem Gandha. Someone has asked this doubt.
Okay.
Can you relate to the cases? Can you, ma'am, relate to the cases which you presented?
Yeah, I remember.
Platina, okay.
And dull camera, right? So as
Yes.
platina and dull camera are very similar remedies, right? Platina will also talk with a lot of command. Dull camera will also talk with a lot of command. But in platina, what we can see is that platina is never caring and affectionate towards the family members or anyone whom they love. They will not be very lovable. They just want, and they command. They will not give. But she had a lot of affection. She had a lot of care, and she was possessive and commanding and demanding only to her loved ones. So this differentiated me from platina and dull camera. So platina knows just to take, and dull camera gives and take, but she is like a platina.
Okay, thank you, ma'am. So another question, like in that health syndrome which you have presented, there is a question from Muskan. He's asking HB is lower down in this case. So what to do in that condition?
See, I have asked such a patient whatever medicine she was taking for to increase her hemoglobin, she was giving bad reaction. So I have just given a good diet which is rich in iron and which is not any medicine, because only then I could help her. So you have to always guide your patient with good nutrition, with proper diet. Like I asked to have, spinach soup, nachni, ragi ka sattu something, ragi ki chapati. I asked these things which are more natural and healthier. And the patient followed that and she maintained her hemoglobin.
Okay, thank you. Another question from Dr. Tendral. She's asking, can you please explain the difference between Merck group of remedies?
Merck group and which group do you want?
I think the
Maybe she's Merck Sol might be the other Merck group remedies like Merck Sol, Merck or something like that.
It's a very big topic again.
Yeah.
See, Merck remedies, they work. Even Merck, I'll tell you a case. Merck Sulf, Merck Cor, Merck Rubrum, Idem, Merck Flavum. These are most very commonly used remedy in my clinic on the basis of totality. So Merck remedies, when you understand this, you have to understand, see their restlessness, see their energy, see the way they behave, the way they talk. Merck are little bit disobedient. They will not tolerate injustice. They will tease others. They will be destructive and they are very mischievous. Like mischievousness is Merck. Remember, they like mischievousness. They tease others. They are jesting. They are little destructive when they are angry. There's salivation which you have to confirm. So Merck maybe in first stage is not that destructive. In first stage, they are just contrary. You will see little things like mother will say sit and they will stand. Mother will say go to right, they will go to left. They are very contrary. They cannot take injustice. They will react to it. They have a lot of salivation. They are restless children. They're very quick. They're very fast. You think of remedies like Merck. You can think of Merck in those states.
Okay. And the doubt from Dr. Hema Suresh, she's asking, what about our regular children like Sina and Chamomilla?
Sina and chamomilla, yeah, I do give, but yeah, again, chamomilla child, when you have to give, when you see a child who is oversensitive to pain in chamomilla, chamomilla, if the child is hurt, where the child gets pain to the intensity of 2, they will react to an intensity of 10. This is chamomilla. Overreaction to pain, oversensitive to sensitiveness to pain. They always want attention. They always want, what do you call? They like to be carried, but they are at the same time very irritable, and their voice is very shrieking. And again, there are some physical symptoms which we can correlate, like their diarrhea and their weeping. We can confirm with chamomile.
Okay. Another question from Muskan Parwani is asking whether the dull camera characteristics is only seen in the child or it can be related to any age group.
Any age group. But yeah, there will be some differences in adults and child. But yeah, you can see this picture even in adults. They will present the same way in a more, I can say, a more compensated way, in a more beautiful way. Like, I'll just say with a small case, I had a case of very bad migraine. That woman, she was a principal in a school and she used to get migraine, and she had to take tramadol injections. She had to get admitted in hospital once in a month. So taking her history, she was very lovable, nice, she was responsible woman. Her sisters, they gave a history that she's a very dominating lady. She has 2 siblings, and of the 2, no one can take any decision without asking her. Though this woman, she was 50 and her siblings were around 50, but they cannot take any decision without asking the elder sister. So this was her possessiveness, this was her command. So I gave her Dulcamera and it helped her. So you can correlate.
Okay. So another question, how do you easily distinguish chronically worm affected children?
God, pardon me, I couldn't get the question.
Chronically worm affected children, might be the worm infestations.
Yeah, you can always check for some physical symptoms, like there is salivation, itching, increased appetite, and you can get a blood test done in which you can see the some counts have increased, so you can know it is worm infestation. Again, not every child will get worm whose immunity is not good. They will have worm infestation because our intestines have a very good flora, bacterial flora, and this bacterial flora do not let the worm survive. When the intestinal flora is disturbed, the child gets worm infestation. They have each
Okay.
some symptoms.
Yes,
Joyce,
yes.
I have also received some doubts. Can I ask?
Yeah,
Yes,
sir.
yes, of course.
What is the difference between carb and mure?
MAC, carb, and MAC mu. So MAC carb and MAC, we know magnesium, love, affection. They cannot take rejection. Carb will be still in that stage where I couldn't get love, I was not getting affection, he will complain to you because there's a carb element. Carb is what they still need support. They have not come out of that support. But magnesium mule, because of the muraticum element, they are much deeper. They take the feeling so deep that these magnesium patients, first of all, they cannot tolerate disharmony. Whenever there's a fight, they'll try to pacify because of the muraticum element, and they become very anxious. They are one of the most anxious and nervous remedy. Magnesium carb intensity is the intensity of magnesium mules, anxiety, nervousness is more than magnesium carb, and they are not aware of that they are anxious. In the morning, they are very angry. They are not in a good mood. So you have to just understand something about mu, something about magnesium, something about carb, and you have to just try to apply.
Dr. Joyce, are you getting any doubts?
No, no, it's all done, I guess.
Ma'am, can you give some suggestions to read the Mecha Medica part?
Yeah, Matra Medica, you have to go for the basic, like the graphitis, as I said. Trust me, I got this from Boric. I was just going through boric, and I just went to graphitis, and I was amazed to see this beautiful picture of graphitis child, and I started applying. So stick to basics. This is the first thing, because what I believe, our stalwarts like Dr. Kent, Dr. Herring, Dr. Vitilka sir, Dr. all our Stroboger, they have worked really, really hard for homeopathy, and their work is very authentic. Make that as a foundation, and then you read new people's book, which you can build up on that foundation. But if you just straight away build up your foundation with new authors, then things will be little hash bash. So stick with stalwarts and then build your house with new authors.
Okay, thank you, ma'am. Thank you. So, hope it's done. Now I will invite Dr. Vineet Siddharthan for the vote of thanks. Sir, please.
Dr.
Hi, good evening, doctors. Hi, dear doctors. I'm Vineet Siddharthan. My intention on this beautiful evening is to thank Dr. Shelly for the wonderful presentation.
Welcome.
Dr. Shelly, thanks for accepting my invitation for the event. She's my friend since 1 year. We've been together in Sorrento, Italy for the presentation, and we shared the prize for the good case there. On behalf of IACH chapter, please accept my sincere appreciation for the outstanding presentation you made in this evening. I would like to thank you for conglomerating all the basic pillars of homeopathy like mathematical, repertory, and case taking, especially observation in pediatric cases. It was a wonderful, wonderful event, Dr. Shelly. I thank all the doctors who attended this webinar. Thank you, and good night.
Thank you, Dr. Vineet, and thank you everyone for patiently listening me till 10:30. Thank you so much.
Thank you, ma'am. Thank you. So we'll wind up.
Yeah, take care.
Good night. Good noon.
Okay, good night all. So we have noon session and evening session there. Please stay tuned to our WhatsApp channel and Telegram channel. So thank you, ma'am. And thank you all. Good night.
Good night.